If you are over 60, there are 5 private health mistakes that can turn a manageable problem into a much bigger one. Not because you are careless, not because you failed to take care of yourself, but because many people were taught to stay silent about anything involving the bladder, intimate skin, sexual function, or a new relationship. One mistake begins with the sentence, "It is probably just my age." Another begins with a product labeled natural, discreet, or fast-acting. And the most overlooked mistake comes from believing that a certain health risk belongs only to younger people. Today, we are going to separate what may be common from what should be checked, and what may need urgent care. No embarrassment. No exaggerated promises. No pretending that one symptom proves one disease. The examples in this video are fictional, but the medical guidance is based on information from established health authorities. This is general education, not a personal diagnosis. Stay until the end, because I will give you a private 60-second check you can do without telling anyone online. And pay close attention to mistake number 2. It can enter your body in a tiny packet, capsule, chocolate, or spoonful of honey, while hiding information that should have been on the label. Imagine a 68-year-old man we will call Robert. For several months, Robert notices that his urine stream is weaker. He wakes 2 or 3 times at night. Sometimes he finishes, walks away, and still feels as if his bladder is not empty. He does not mention it at his medical appointments. His reasoning sounds sensible. His friends joke about older men taking longer in the bathroom. He can still urinate. Nothing hurts very much. So he tells himself this is simply what happens after 60. Then one evening, the urge becomes intense. He stands in the bathroom, waits, strains, and almost nothing comes out. That is private health mistake number 5, deciding that a new bladder change is normal aging before the cause has been evaluated. Age can change the body, but age is not a diagnosis. A weak stream, difficulty starting, frequent small trips, leaking, or the feeling that the bladder has not emptied can have several possible causes. In men, prostate enlargement may contribute. In women, pelvic support changes may play a role. Constipation, certain medicines, nerve problems, infection, or another blockage can also affect urination. The important point is not to diagnose yourself from a list. It is to notice a pattern. A single unusual bathroom visit may mean very little. A symptom that is new, persistent, worsening, or repeatedly disturbing your sleep deserves a conversation with a healthcare professional. And there is one bathroom situation that should not be treated as a routine appointment. If you suddenly cannot urinate, especially when your lower abdomen feels painful, swollen, or extremely full, seek emergency medical care. Sudden urinary retention can be serious. Robert waited because he thought the absence of severe pain meant the absence of a problem. But chronic urinary retention can sometimes develop with mild symptoms, or even very few symptoms, before it becomes obvious. There are other signals worth reporting. Burning during urination, frequent urgent trips, discomfort in the lower abdomen, or cloudy or bloody urine can occur with a bladder infection. If urinary symptoms appear with fever, chills, nausea, vomiting, or pain in the back or side, prompt medical attention matters because those symptoms can occur with a kidney infection. Visible blood in the urine also deserves medical evaluation. It can have different causes, and the appearance alone cannot tell you which one is responsible. Here is what makes this section useful instead of frightening. You do not need to remember every possible condition. You need to remember 3 categories. A gradual but persistent change means make the appointment. A sudden inability to urinate means seek emergency care. Urinary symptoms with fever, vomiting, or back or side pain mean contact a healthcare professional promptly. Before your appointment, keep a simple bathroom record for 2 or 3 days. Note how often you go, whether the stream changed, whether you leak, how often you wake, and whether you feel empty afterward. Also bring an updated medicine list, including non-prescription products. Some medicines can contribute to urinary retention, and your clinician needs the full picture. But embarrassment does not always make people ignore a private symptom. Sometimes it makes them attack it. Consider another fictional example. Elena is 66. She notices occasional irritation and a change in odor after long days when urine leakage dampens her underwear. She becomes worried that other people can smell it, so she buys a perfumed wash, then scented wipes, then a deodorizing spray. The more irritated the skin becomes, the more aggressively she cleans it. That is private health mistake number 4, using harsh or scented products on sensitive, intimate skin because you are trying to feel cleaner. The intention is understandable. The result can be the opposite of what you wanted. The skin around the genitals can be sensitive at any age. After menopause, vulvar and vaginal tissues may become drier and more delicate. Perfumes, dyes, deodorizing products, douching, fragranced wipes, and repeated scrubbing can irritate tissue and disturb the vagina's protective balance. The vagina does not need internal washing. Douching can remove protective bacteria. External care should be gentle. For the vulva, guidance from the American College of Obstetricians and Gynecologists recommends avoiding scented products and douching, rinsing gently with cool or lukewarm water, and patting rather than rubbing dry. When cleanser is used externally, it should be plain and fragrance-free. For men, the same principle applies to sensitive external genital skin. Gentle washing, thorough rinsing, and careful drying are safer than scrubbing or covering symptoms with perfume. Anyone with a catheter, wound, recent procedure, skin disease, or difficulty retracting the foreskin should follow individualized medical advice. The goal is not to make the body smell like a flower. The goal is comfortable, intact skin. If dampness is the problem, change wet underwear or incontinence products promptly. Choose breathable clothing when practical. If a new product caused burning, stop using it rather than adding another product to calm the first one. And if irritation, sores, swelling, discharge, unusual odor, or itching continues, arrange an evaluation. Several conditions can produce similar symptoms. A cleanser cannot tell the difference between irritation, a skin disorder, urine-related damage, and infection. Elena's turning point is not finding a stronger wash. It is realizing that odor can be information. When she treats the skin gently and discusses the leakage with a clinician, she stops fighting the surface and begins addressing the reason it keeps becoming damp. That distinction matters. Private care should solve the cause when possible, not punish the skin for showing the symptom. Now we move from the bathroom to a conversation that many couples postpone for years. A change occurs during intimacy. There is dryness, pain, bleeding, difficulty with erections, reduced sensation, or a medication side effect. Nobody wants to embarrass the other person, so both pretend nothing happened. That is private health mistake number 3, enduring repeated pain, bleeding, or sexual function changes without discussing them with a partner or healthcare professional. Some changes become more common with age, but common does not mean you must suffer silently. After menopause, lower estrogen levels can contribute to thinner vaginal tissue, less natural lubrication, irritation, and pain with penetration. Water-based lubricants and vaginal moisturizers may help some people. Prescription treatments are also available, but which option is appropriate depends on your symptoms and health history. Pain is not something you owe a partner. It is a reason to slow down, stop, change the activity, and find out what is causing it. A useful sentence is, "I want closeness, but this is uncomfortable, so we need to pause." That sentence protects intimacy better than pretending. Bleeding after menopause requires special care. Any vaginal bleeding that occurs after menopause should be evaluated by a healthcare professional, even when it is light or happens after sex. Thinner tissue and friction can be responsible, but an examination is needed because there are other possible causes. This does not mean bleeding automatically means cancer. It means the cause should not be guessed at home. For men, erectile difficulty becomes more common with age, and an occasional problem is different from a frequent or persistent change. If it happens often, discuss it with a healthcare professional. Health conditions, emotional stress, and medicines can all affect sexual function. Some blood pressure medicines, antihistamines, antidepressants, sedatives, and other drugs may contribute to sexual side effects. Never stop a prescribed medicine on your own. Instead, use direct language. "Since starting or changing this medicine, I have noticed a change in sexual function. Could the medicine be contributing?" That is not an inappropriate question. It is medication safety. And if your clinician appears uncomfortable, dismissive, or unwilling to listen, that does not make the symptom unimportant. You may need a different clinician or a referral to someone with experience in sexual health, menopause, urology, pelvic health, or medication management. Now, here is the reframe many people need. The healthiest intimate life after 60 is not the one that looks exactly as it did at 30. It is the one that adapts without shame. Closeness can include conversation, affection, touch, patience, different timing, different positions, medical treatment, or choosing not to engage in an activity that hurts. Your body has not betrayed you because it needs a different approach. But there is a dangerous shortcut people sometimes take when they are too embarrassed to discuss these changes. It can be ordered online. It can be sold at a convenience store. It can appear in a glossy packet with words such as herbal, natural, maximum strength, or instant. This is private health mistake number 2. Taking unverified sexual enhancement products or leftover medicine without checking what they contain and how they interact with your current medications. The packaging may look professional. The reviews may sound convincing. The product may be sold as a capsule, gummy, drink, honey, powder, or chocolate. But the U.S. Food and Drug Administration continues to warn about products marketed for sexual enhancement that contain hidden drug ingredients. Some have contained undeclared ingredients found in prescription erectile dysfunction medicines. That creates a serious problem. A person can believe they are taking a supplement while unknowingly taking a prescription-strength substance. Certain erectile dysfunction drugs can interact with nitrate medicines used for chest pain and lower blood pressure to dangerous levels. The danger is not that approved prescription treatment is always unsafe. The danger is taking an undeclared drug without medical screening, accurate dosing, or knowledge of interactions. Never borrow another person's prescription. Never assume a product is safe because it says natural. Never combine a sexual enhancement product with prescribed medicine until a qualified doctor or pharmacist has reviewed it. And do not let embarrassment hide the evidence if you feel unwell. If you develop chest pain, fainting, severe dizziness, or another severe reaction after taking a product, seek urgent medical help and tell the medical team exactly what you took. Bring the package or a clear photograph when possible. They need the truth to treat you safely. The same rule applies to leftover antibiotics. Burning urination does not automatically prove a bacterial infection. Several problems can produce overlapping symptoms. Taking an antibiotic left over from an old illness, stopping when you feel slightly better, or taking medicine prescribed for someone else. can delay the correct treatment and cause side effects. The Centers for Disease Control and Prevention advises people not to save antibiotics for later, not to share them, and to take them only as prescribed for the current illness. A safer habit is to maintain one complete medication list. Include prescriptions, over-the-counter medicines, vitamins, herbal products, powders, gummies, and anything used only before intimacy. Bring the list to appointments and show it to your pharmacist when adding a new product. There is no private supplement that is too embarrassing to place on that list. In fact, the product you most want to hide may be the one your pharmacist most needs to see. Now we reach mistake number 1. It is not a bathroom habit. It is not a product. It is an assumption. Imagine a woman named Diane, 71, who begins dating several years after losing her husband. She and her new partner are both past the age of worrying about pregnancy. They know each other's families. They both appear healthy. Asking about condoms or testing feels strangely clinical, almost insulting. So they skip the conversation. That is private health mistake number 1, assuming that age, trust, or the end of pregnancy risk also removes the risk of sexually transmitted infections. Age does not provide immunity from an STI. Older adults who are sexually active can still acquire infections. Many STIs cause no obvious symptoms, so appearance and good intentions cannot confirm that someone is infection-free. This is why testing is not an accusation. It is shared information. The CDC advises sexually active people to have an open conversation with a healthcare professional about which STI tests are appropriate. The right tests and timing depend on factors such as sexual history, current practices, partners, symptoms, and individual risk. Barrier methods reduce the risk of many infections. The National Institute on Aging advises older adults to use condoms during vaginal or anal sex and appropriate barriers during oral sex when protection is needed. A respectful conversation can sound like this: I care about both of us, and I would like us to talk about testing before we stop using protection. Or, my last screening was on this date. When was yours? Notice what those sentences do not contain. No accusation, no interrogation, no assumption about someone's past. They simply recognize that a person can have an infection without knowing it. Diane's real risk was not dating after 70. It was believing that responsible sexual health conversations had an expiration date. They do not. Now let us bring all 5 mistakes into one private check. Do not answer these questions in the comments. You do not owe the internet your medical history. Just answer them honestly to yourself. Has your urine stream, urgency, frequency, leakage, or ability to empty changed? Have you seen blood in your urine, felt burning, or developed urinary symptoms with fever or pain in the back or side? Are you using scented products, wipes, powders, douches, or sprays because you are trying to cover irritation or odor? Has intimacy become painful? Has there been any vaginal bleeding after menopause? Has erectile function or another aspect of sexual function changed repeatedly? Are you using a capsule, honey, chocolate, powder, gummy, or leftover medicine that your doctor and pharmacist do not know about? Are you beginning a new sexual relationship without discussing protection and testing? Now choose one action, not 5. 1. Write down the symptom. Remove the product that is irritating your skin. Update your medication list. Call the clinic. Ask the pharmacist. Begin the conversation with your partner. The goal is not to become afraid of your body. The goal is to stop allowing embarrassment to make medical decisions for you. If this video gave you a clearer way to think about a private symptom, subscribe for calm, evidence-based health guidance after 60. And if you leave a comment, protect your privacy. Simply tell us which subject deserves a full video next: bladder health, medication safety, or intimacy after 60. And remember the urgent signals. Seek emergency care if you suddenly cannot urinate, especially with severe lower abdominal pain or swelling. Contact a healthcare professional promptly if urinary symptoms occur with fever, chills, vomiting, or pain in the back or side. Arrange medical evaluation for visible blood in the urine and for any vaginal bleeding after menopause. Call emergency services for chest pain, severe difficulty breathing, fainting, sudden weakness, facial drooping, speech difficulty, or another severe sudden symptom, regardless of whether it begins during a private moment. There is nothing undignified about asking for help with bladder health, intimate skin, sexual function, medication effects, or infection risk. Dignity is not silence. Dignity is having enough accurate information to act before a manageable problem becomes a crisis. And this leads directly to the next conversation. Because sometimes the mistake is not what a person does before intimacy. It is what they dismiss during it, as nerves, age, or ordinary tiredness. In the next video, we will examine 7 warning signs adults over 60 should never ignore during intimacy, and the difference between a moment to pause, a reason to call a clinician, and a true emergency. The final sign can feel deceptively ordinary, but when it begins suddenly or feels unusually severe, what you do next matters.